Good afternoon. It's Eric Roth, Assisting Hands, and it's the Friday finish. Welcome and glad to have everybody here. Let me get my screen straight here and we will get started. I'm really excited about today's Friday finish. I got a special guest I'm going to introduce you to here in a second. I got to do my little technical stuff. I'm going to share my screen and here we go. All right. So again, I'm Eric Rohr with Assisting Hands Richmond. We've had a great week this week. We provide support for people who want to remain in their home with their activities of daily living. We also specialize in families and individuals living with dementia. I'll talk a little bit about that more. And our goal is to help everyone remain happy and at home. So let's kick off kind of what happened in our office. Really excited. We had some great new hires. We're always looking for caregivers, our star caregivers. So we had orientation with 4. You can see we got a little bit of personality here. We got Ray on the far left, Sasha, Jessica, and Echo. And they did a great job in orientation. In fact, we had a really good time. I spent the first part of every orientation I spent with them talking about the values of the company and how much we really focus on our caregivers. So we're really ready for them to get going. And in fact, I think I know some of them are already on cases, if not all of them. So that's really exciting. All right, second thing, I think if anybody of you all follow me on Facebook, we're really focused on dementia education. And, I've said this before, but Kathy Hamlin, who's our executive administrator, she's a PAC certified dementia coach. And PAC is a positive approach to care, which is the TIPA Snow dementia training that if you don't know TIPA Snow, check her out. She's phenomenal. But Kathy went and became a certified dementia coach. And Kathy has developed all these dementia workshops from her training, her experience. And we offer these at no charge for really anybody who wants them. So they're for people that are in active adult communities, independent living communities, assisted living communities, memory care. These can be for professional caregivers or family caregivers. And again, there's no charge. If you all have heard me speak, I spend, my sister has early onset dementia. And so my awareness of this has just tremendously increased in terms of how to communicate with her and how our family provides her the support she needs. So anyway, if you have any questions, contact us and we'd love to talk to you about any of our dementia workshops. All right, now it's time for the shout out. All right, let me stop sharing my screen and see how we do this. You may have seen it. So Kim Roth from Partners in Healthcare is here with me. So let me just tell you a little bit about Kim, and I need to unmute her so she'll be able to eventually speak. But I was introduced to Kim through Deborah Willis. So if anybody Partners Healthcare know Deborah Willis, but got me hooked up with this organization. I was new to home care and healthcare in Richmond, Virginia, and everybody says, you got to meet Deborah and Kim. And I did, and they've been phenomenal for me in helping me find the right networking groups, just get acclimated to the whole kind of niche here in Richmond. And so that's how I got to know Kim, and we talk a lot, and I'm really impressed with what they do at Partners in Healthcare. So welcome, Kim.
And thanks for having me.
Yes, definitely. So why don't you tell us a little bit about yourself and how you got involved in Partners in Healthcare, and then I'll give you an opportunity to talk a little bit about what Partners in Healthcare is.
Great. Well, I was an out-of-care caregiver. I took care of my grandmother for 13 years, and I started something else when I was an out-of-care caregiver, and I thought, this isn't for me. So I got into healthcare, and I was a home health rep. And I, too, met Deborah Willis, and she said, well, this is what we do. And I said, I love it. And I kept making suggestions on how, at the very beginning, Partners was doing or formatting their educational resources to the community and to the hospitals. So I eventually made the leap and I joined Partners in Healthcare full-time, and I run their educational in-service program and really all things partners, so that Deborah and the board that I report to can work on whatever jobs that they have. We were very fortunate at the very beginning to have the opportunity given to us by Jody Parker, who was at that time the director over both CJW campuses in Chippenham and Johnston Willis. And the board went and talked with her and said, what do you think? And the rest has been history. Chippenham and JW remain to be our flagship hospitals in our program even today, 12 years later.
Oh, good. Oh, you know what? I forgot to share the screen, so we're going to do that. So
That's
sorry
okay.
about that. All right. So why don't you give us a little bit of what is Partners in Healthcare? You know, who is Partners in Healthcare and where is Partners in Healthcare?
Right. Partners in Healthcare exists on a triangle of partners. And the way that we've approached this was to support our acute hospitals, our case managers, social workers, discharge planners with resources in our community. So they become our educational partners. And then our support comes from the community, such as new franchise owners like yourself, or a new rep that has just moved to the area and is now either in hospice or home health or infusion or oxygen. And what we do is we put them all together like a rotary wheel and really look for strategic relationships and also strength of continuity of care to be provided to patients when they discharge from the hospital.
Yep. And can you, and I have a slide that may collect this, but can you tell me who all the participating facilities or hospitals are for Partners in, or give me the, you know, like how many are there?
Right. On our regular rotation, really for 2020, we had secured 13 locations for our partners members to go in and meet over lunch, make presentations, and talk about those things that they would want their case managers, social workers, and discharge planners to know, to speak to the family about putting a care package together for a safe discharge. We are in all, well, let's see, yes. We have 4 HCA, we were in 4 Bon Secours, both of the Encompass Rehab Hospitals, VCU, and Vibra, as well as a large insurance company where we met with their case managers for both the Medicare and Medicaid products to assist their care managers with their clients.
Yeah. Yeah, and I presented, I think, in most of those, if not all of those, and that was great. So
I'll tell you what's been interesting now that we are in the COVID era of Partners in Healthcare. We did have to shift from in-person presentations to what we are now calling our stress relief program, where our partners members still go in. And as you can see on the screen that our case managers and the hospital still need references. People are still changing jobs, or they're PRN, or they're working from home and they're trying to put care plans together. So this is really essential for us to be still supporting our critical care hospitals in the Richmond area.
yeah, one thing I've loved is, you know, obviously the pandemic, we wish it wasn't happening, or the like, is seeing how organizations have pivoted and figured out how do we still deliver our services in the best way we can. Because, you know, I know when it happened, everybody's like, what do we do? And I really appreciated the way you pivoted, Kim, and said, look, it was almost a paradox or irony that we were supporting the frontline workers that really probably needed our thanks and our support more than ever, but we were now not allowed to go visit them like we normally were. And I was very appreciative of how you said, well, how can we still support them and do it in a different way? So.
And the benefit to us as partners, collectively, our members and just our, partners organization, is that our consistency has not wavered, and we have opened more opportunities for our members. We are in the COVID ICU unit and supported them, and the step down unit, and opened 2 hospitals that had not been with us in some time. So our ambassadorship, if you will, and staying connected with our partners in the community and our partners in the hospital to give them that education and support. The bottom line is we're here for the patients and families in Richmond and surrounding areas through this program.
Yep, that's awesome. And I think I just saw some emails earlier this week or last week. You got it all teed up for August. So this hasn't been a one-time thing. This has happened every month. And I guess it will continue to happen until
as long as there's a need, and we, do not have presentation ability in person, we will continue to do this as long as there is a request. All of the hospitals that you are showing on your screen requested that we come in and deliver the lunch, and all the funding members that are providing that lunch have had the opportunity to provide updated COVID requirements or patient care, or our community is accepting, or these are the requirements. So again, we pivoted with the knowledge that our partners members would be supportive, which they have, and our education partners, which is our hospitals for sites, and that continuity has made this program successful.
Yeah. And so how many total partners are right now participating in these monthly stress relief lunches?
We usually have, and it varies because it's an opt-in, opt-out every month, whoever wants to. But I would say the first, I say we probably vacillate from maybe shy of 20 to just shy of 25.
That's great.
And the interesting thing is, again, I go back to that rotary wheel with all the different spokes of all the different types of help that are available. Not only is it medical, but we've also got psychological help for families that are dealing with either a medical loss or psychological loss of what's happening in COVID, but also drug recovery. And this is a situation where this is a very difficult time for many of those folks. So they do present to the hospital. We still are providing that information to those social workers to connect them with care.
Great. All right, great. Well, I'm putting your contact. So if anybody out there is interested in becoming a member of Partners in Healthcare, I encourage you to reach out to Kim Roth. There's her information on the screen, or if it's too quick and you can't pause the video, reach out to me and I'll get you her information. But highly recommend them. I've loved both the in-person, but now supporting the hospitals and their case management teams with the stress relief lunches. Anything else? Any final thoughts, Kim, before we end your portion?
No, just that if you have a senior that you know of, make sure that you call them, maybe even write them a letter and remind them to stay cool and hydrated, especially with these high temperatures, because a lot of our seniors will present to the hospital with dehydration, and this is not the time to do that with COVID around. So if we can do those things in a loving way, that's my message to our folks that can check on seniors. And I know that's your business, so it's very important. And I thank you so much for the opportunity. It's a pleasure to work with you and your team. All
right, great. Well, I just got to wrap a few things up. So thank you, Kim. I'm going to keep pushing this all the way to October 31st, but I have formed an Assisting Hands Richmond Walk to End Alzheimer's team. here's the information you need to sign up, but please reach out to me. And that's either join the team and walk. And right now it's going to be a live walk, again, October 31st. So hopefully that gives us enough time to get everything settled down. And the route is only 1 or a 3-mile walk option. If you don't want to walk, there's plenty of other volunteer opportunities, or donate to the Alzheimer's Association. We do have a team site that we're trying to raise at least $2,000. And so please reach out to me and help to end Alzheimer's. And I love it. It's about help us lead the way to Alzheimer's first survivor. So that's all I have for this week. Hope everybody has a great weekend. I guess we have some storms coming in up and down the East Coast. So hopefully everybody stays safe. And again, we're here to help you remain happy and at home. Have a great weekend. Thanks.